An economist at Ball State has released a study that claims Indiana's not-for-profit hospitals are not living up to their tax-free obligations. Those health systems, including Parkview, are designed to put any excess earnings back into local communities rather than sending them off to corporate shareholders. Economist Michael Hicks says they're not.
And that is exactly the opposite of what's happening in the nonprofit industry. We're seeing profits flow away from Indiana instead of being reinvested here, instead of being used by consumers for other purchases of goods or services. They're going away to hedge funds and money market accounts that are held by IU Health and St. Vincent's and Parkview and others.
The study really overinflates those numbers in a way that I think is irresponsible.
Brian Tabor, president of the Indiana Hospital Association, contends the numbers in the study look at only one side of the balance sheet. In 2017, Parkview showed holdings of roughly $1.1 billion, but the study seemed to ignore the $800 million in liabilities.
And many of our systems, while they may show reserves that look healthy, have debt because of projects that they built, investments that they've made in their community.
Is $1.1 billion in investments too much cash on hand for a nonprofit hospital of Parkview size? Moody's Investor Services seems to say no. They give Parkview Health an AA3 rating. That's their fourth highest. Think like A-. And one of the risks, they say, for Parkview would be a notable contraction of balance sheet resources, meaning they could be downgraded if they had less cash on hand. Still, Dr. Hicks says instead of Wall Street, they could invest that money here.
They're not providing a public purpose by pulling out money, parking it in Wall Street and making money on it. The public purpose could be returned by investing in Indiana, by investing in Indiana communities, by investing in healthcare education, by investing in healthcare outcomes in Hoosier families.
Parkview, as we told you at 5, declined our request to appear on camera. You can see their response, though, and the original study right now on WANE.com.